Well, during the 1980s, the rural economies went bad and rural hospitals started to close. And this engendered a lot of interest on the part of the Congress, in particular, the Senate Select Committee on Aging. And they held hearings and tried to figure out what kinds of things you needed to do in order to keep rural hospitals open and improve rural health care. There needed to be a focal point in the federal government for rural health issues. And they decided that they would create an Office of Rural Health.
Like any other startup, it was all about the people. It's the people in the beginning that made this happen. There were a lot of pretty strong personalities in that original group. We had Jeff Heumann, who was the director, and he was able to keep us together.
At that point, I had been acting director of the National Health Service Corps and a deputy director at the National Health Service Corps before that. And that's a program that places doctors into rural areas. And I had a pretty good sense of those kinds of issues, the need for health personnel in rural areas.
We had all come out of the 60s. We were definitely looking for a cause. And none of us were particularly rural or knew anything rural or whatever. And I think we shared this ethic. It was an issue of equity. And so that bonded us.
We didn't really have any power or authority. At the beginning, we didn't even have any programs. We were just a policy office.
Well, there were a lot of challenges in the beginning. We didn't have any money. We didn't have any positions. We didn't have any office space. We didn't have any authority.
On the first day I got the job, I got a request to go down to Senator McCain's office. It said basically, we don't expect you to perform miracles in this office, but we do expect you to pay a lot of attention to the issue of closing rural hospitals, and we expect you to keep us appraised of what we can do to help solve that problem.
Most of what we did never would have happened without the National Rural Health Association. At the time, they were new, we were new. And two things that they did that were critical. One was we created kind of this triangle, if you will. It was us and them and the Hill. And so they connected us with people down there who were interested in doing something and also helped us. And that was absolutely critical early on.
One thing that we did was particularly important, and that was to establish a National Advisory Committee on Rural Health. This meant we had a Citizens Advisory Committee working with us, and they had a voice that we didn't have. But once we had the National Advisory Committee on Rural Health, and once they began to take aggressive positions as a Citizen Advisory Committee, then I could say, well, the department really hasn't established a position on that. But the National Advisory Committee on Rural Health, under the direction of former Governor Bob Ray of Iowa, has taken the following position. And that did get listened to.
Members on the Hill got this report with the recommendations. And we sent it to anybody who cared. We also sent it to the press. And so it was a way of pointing out issues, challenges, and problems, and also solutions in these recommendations. It was awesome. I don't know how we got away with sending it to the Hill for years. None of us really knew anything about research. And so NRHA hooked us up with a staffer from Burdick, Senator Burdick, who was from North Dakota, and her name was Mary Wakefield. So Mary took me out to North Dakota, and we spent a couple of days in this rural research center, and the director was Kevin Fickinger. So we wandered around for a few days, and I learned all of this stuff about a research center and how it operates and what they do. I didn't know anything about research, but I could see that the North Dakota office was just doing a great job. Came back, shared it, got some input in the office, and wrote guidance for the first Rural Health Research Center's grant program.
One of the first things we did was create a, let's say, a program of putting out bite-sized information to legislators and policymakers, both in rural communities, in the Congress, in the administration, and in the business world, the people who owned and operated hospitals. And we created really a program of issuing policy briefs once or twice a month. And it became very effective. Then we began to be looked at as a place where people could get answers.
The idea was that we really didn't understand fully problems of access to health care and what the best solutions would be, problems of hospitals closing and what the best remediation strategies would be, and that these centers could help us to establish that.
The Federal Office of Rural Health Policy has been really a uniquely successful element in government, and I wish I could say that for other parts of the federal government, but I really do respect them and what they've done.